everybody
Hi
to
there.
Thursday session with Brandy and myself, Dr. Mason.
Hello everyone, this is Brandy Murphy, Director of nutraMetrix, here with Dr. Mason, our Director of Clinical Research and Education. We're happy to see several of you on the line to join us today in our topic about the role of privacy and protecting privacy in the health professionals' offices when you're working as a nutraMetrix consultant. You know, Dr. Mason, one of the questions that comes up in our Facebook group quite a bit is, what is HIPAA and how does it relate to the NC? What do I have to do as an NC to help ensure that I'm protecting the privacy of the practice? So I thought it would be great for us to talk about that today as our topic. Can you give them a little bit of an overview of what HIPAA is? You know, sometimes we'll hear people talk about it as HIPPO. It's not HIPPO. What is HIPAA? What does it stand for? And why do NCs need to be aware of it?
So HIPAA, or as you've seen it, HIPAA, is the Health Insurance and Privacy Accountability Act. I don't think I said that right. No. HIPAA is the Health Information Privacy Accountability Act.
That's right. That's right.
Well, the point is that there was a question at one point with insurance always being regulated, but with insurance being what it is and people having different types of plans and different types of programs, as well as being able to improve kind of the communication between healthcare providers. It was, how can we ensure in this data age, how are we going to keep a patient's or a client's healthcare information private? As we became, with practitioners, as we started to share information through other than paper resources, fax machines, the digital age, being able to teleconference and the like, we needed to kind of regulate a patient's information or the chart well enough so that we could secure it and that it would not be something that would lead to fraudulent activity, or someone would be able to get your social security number and, God forbid, be able to get some any healthcare information about you, diagnosis, the drugs that you take, the drugs that you don't take, patient visit information.
You know, patient information is so portable now, you know, with the electronic records, et cetera. And as we move from one practice to another, as a patient, we see this. Every time that we go to our doctor's office for the first time for that year, every time we go to our pharmacy for the first time that year, we all have to sign off on a privacy statement, which states that we understand that that practice is going to do, or that pharmacy or whatever, is going to do the best that they can to protect our information and make sure that we are protected.
Right. So any practice like mine or like the pharmacist in that case will have patients sign a privacy statement saying that they understand that for the purpose of me doing business, I may need to speak to other healthcare providers or other people that are in the medical arts about your healthcare. This includes information about diagnoses, drugs that you take, treatment plans or treatment options that I may send digitally to another practitioner. I may send digitally or through an electronic record to an insurance company, and that you understand that. What I really want to be sure that everyone also understands is that there's two facets of that where we as business partners come into play. First, let's just understand this. Physicians, pharmacists always kept your healthcare information private. We just never were required to tell you that we did that before. We always went to great lengths to make sure that we didn't share your information. But the first thing I wanted to bring up is how we as nutraMetrix consultants or representatives of nutraMetrix may want to talk to healthcare providers is by the fact that we have developed a business relationship with them. And Brandy, by developing a business relationship with them and entering into a way of detailing them about the benefits of nutraceuticals in their practice, including financial information, one of the things that ends up coming across is that practitioners may be concerned that how are they going to keep their patients' information private, because you have access not to the electronic medical record necessarily, but access to overhearing patient conversations, access to being asked specific questions about lab work. And while the practice will keep the patient's information private, there are certain areas where the NC may be privy to private information. So the first thing you want to be very aware of in being cognizant of privacy rules is that practice has done something called a gap analysis. In that gap analysis, they've assessed all the different loopholes or places where there may be weaknesses in their practice and being able to protect that information. The NC or the nutraMetrix consultant can be one of those weaknesses or those gaps, and they need to make sure they fill that gap. So you can download or you can speak to an attorney yourself, but documents are available online that are called third-party agreements. And these are agreements that you can give to the healthcare provider that you're working with and say, I understand that patient privacy is the utmost importance to you, and because of that, as a third party that comes into your practice, and let me just give you an example of other third parties. Cleaning staff are other third parties. They have no reason to be able to see healthcare records, but they have access to healthcare records if they're in a paper format or labs have been faxed over. And so that third-party agreement between a cleaning facility and the practice is that they understand that anything that they come across, they have to keep private, and they will not share with family members. They will not share outside of that office. They won't even share with other people that are part of that regular third-party agreement. Well, NCs fall into this as well. You may overhear conversations. Patient surveys may, because they have patient information, sometimes emails, the patient's address, the patient's phone number, but definitely the patient's name. That patient may share some of that information about a family history, a genetic risk factor, or a current health challenge. And because of that, those types of surveys should not be taken out of the practice. We should think each time that we're working with a healthcare provider about all of the different ways that we may be putting ourselves and them at risk when it comes to patient information. So be the consummate professional. Download a third-party agreement that outlines what you will and will not, your role, and that you understand that you will not be sharing any information with someone that you're not allowed to share information with. And that means keeping that information within the four walls of that practice.
And those documents are available just by doing a simple search in your favorite search engine for a HIPAA third-party agreement. There's lots of them available as samples. But my point that I want to take away with you guys is really the biggest gap that we have in protecting patient privacy is really our mouths as the NC, because sometimes we don't even realize that we're violating somebody's privacy. And let me give you a silly example of it that might be a little ridiculous, but it drives the point home. Imagine that you're in one of your health professionals' offices that you're working with, and you're standing behind the counter helping to train the staff on ordering, something as simple as that. And a patient walks by because they're getting ready to go into their appointment, and you happen to recognize that patient as being your cousin. Okay? And so now you see your cousin going into an exam room in the practitioner's office, and you didn't even know your cousin was a patient of that practice. Now fast forward the next weekend, you're at a picnic with your family, and you say to your cousin who you just saw in the doctor's office, hey, I saw you in Dr. Mason's office the other day. What was going on? What were you getting there to be treated? You just violated your cousin's privacy, right? You don't really know what they were there for. You don't really know if they wanted the rest of the family to know that they had a doctor's appointment. You don't really want the rest of the family to know, or you don't know if they wanted the family to know that that cousin of yours is even a patient of that practitioner. So even something as simple as saying, I saw so-and-so in the practice could be a potential privacy violation.
Right, it definitely will raise a higher level of suspicion or concern, even with the patient, not even just with the practice or their staff. Let me give you a more real-world type of scenario that, again, you wouldn't even realize that you were violating HIPAA because you were so excited about the benefits of what you had done with your TLS group.
Oh, yeah.
You had managed to help people lose weight, and perhaps a diabetic or a pre-diabetic that was previously on medication or some sort of pharmaceutical intervention doesn't have to continue with that intervention any longer. They have reduced their insulin. They have moved from some type of pharmaceutical agent or biologic, and now they can use nutraceuticals. And you, as a testimony of the benefits of the TLS program, share that information. I was in Dr. Mason's office. We have this great, really motivated client in my TLS class. Brandy Murphy was there, and she you wouldn't believe what she was able to do. She stopped taking fill in the blank of a drug, and she started taking this. And her blood work went down. Her blood sugars improved. Her high blood pressure got better. You're thinking, TLS rocks. And really what you've done is you violated a patient's privacy.
Unless you have explicit written permission from them
to share their
testimonial.
To share their testimonial. One of the things that I think is also worthwhile when we think about it's not the same type of HIPAA privacy, but I do think that it's relevant to your success in practice and your success as a nutraMetrix consultant. We may also be inclined when we have really successful healthcare practitioners, we may be inclined in our own in our own excitement about what we've been able to create to name drop. And this is something that can be really problematic as you develop yourself or your personality as an NC or a nutraMetrix consultant. If Brandy were to have an account with me where we were just wildly successful with nutraMetrix, and she were to use my name, a pediatrician, fertility specialist, cardiologist, whatever, she would use my information, my name, or my success from my practice to help prospect another practice without my permission. That's an integrity issue, and it's a violation of my privacy.
Especially if I tell them what you've earned through your
Right.
commissions. If I'm all of a sudden out in the marketplace saying, Dr. Mason has created this very successful business with nutraMetrix and she's generated X amount of revenue, and I don't have your permission to do that,
Right.
that is definitely a privacy violation.
So I just want us to think and put ourselves in the shoes of both patients, practitioners, staff, and think about how we can first be a consummate professional. And one of the ways that you can do that is by starting by overcoming the objection before it ever becomes an objection. Bring up that you're familiar with privacy rules, privacy laws, and even third-party agreements, and say that you'd be more than happy to sign that type of a third-party agreement that assures them that you'll keep their healthcare information from the practice private. From there, say, I also understand your professional standing in this community, and because I understand your professional standing in this community, while we will undoubtedly be very, very successful with nutraMetrix in the practice, I won't share any information about what we're doing here without your implied, or with your verbal consent, with us agreeing on what we will and will not share about your success and implementation in this practice.
That brings up a question that comes up often in our groups as well. People will say, can we get a list of other practitioners in our area that are carrying the line, because they have a health professional that might want to talk to another local health professional to see how they're doing. Mm-hmm. And as a company, we don't provide that information. We don't share any of our health professionals' information unless they've given us express permission to do so. So if you have a health professional that asks, who else do you know that I can talk to? Then what we're going to ask you to do is reach out to the existing nutraMetrix consultants in your area, find people who have a relationship with their health professionals where the health professional has given them permission, but don't ask us as the company to violate any of our health professionals' privacy, because we won't do it.
Right. I think that's very. I think it's really good that you brought that up, because those are the types of questions that we get where someone says, I need to speak to another radiologist. We need to see how else. We need to know that there are other people being successful. Keep in mind, we have 3,400 successful practitioners that work with nutraMetrix. We are a fast-growing division of Market America, and the reason for that is that we have a true desire to benefit those around us, patients and practices alike. And the integrity of this product line, the integrity of this company will only translate through you as a nutraMetrix consultant in your own professionalism within the practices.
Yep. So thank you for taking the time to join us today. We wanted to take just a few minutes to address patient privacy, and then you added in the practice privacy, which I think was a great addition to the conversation. We hope that this was informative for you. We look forward to seeing you in future meet-ons. Thank you very much.
Thank you, everyone. And I'll ask you if you want to continue here in a minute. Or my Mac does anyway.